This is SCTD. You are now listening to WDC Radio. Stay tuned for more information on LA Talk Live. We are more than just talk.
We know there are many choices in internet radio, and the staff and host of LA Talk Live would like to thank you for choosing the internet's hottest destination for the most eclectic sound and invigorating talk. This is LA Talk Live. We are more than just talk.
All right, good morning, welcome. This is WDC Radio. I'm your host. I am WDC. I got an awesome show for you today for my lupus and sickle cell community. I have two doctors here, and actually both of them battle those two diseases that they care about. So just stay tuned for that. Dr. Carolyn Rowley's here. I got Dr. Kiana Johnson here. I got my man DBC over here in the corner. You'll see him in a second. We'll be coming right back with you. This is my theme song. You can get it on iTunes, 99 cents. Curtis Blow, Young Ice, and IG The Great. We'll be right back.
Favorite sport, you know I like the way the dribble up and down the court, fast and slow. 25 years ago, the WDC, and it's me, your man Curtis Blow, from Dr. J to Michael Jordan to Kevin Durant, who leads the whole league in scoring. This is Wayne Wade down in Miami, making a name. I love this game. To the NBA Hall of Fame, slam dunks, alley-oops, and the give and go. Vince Carter, Superman, and my man Carmelo and Rondo over in Boston with the big three, captivating audiences across the country and ruling the world like LeBron the King. I say, man, Kobe sure has a lot of rings. That's my thing, not for the bling bling in the amount. It's the NBA Finals, so what's the count?
So if you're tuning in live today, you can go to Atlanta Talk Live, you can go to DC Talk Live, and Las Vegas Talk Live, and we're streaming live from there right now, so you can tune in there. My first half of the show is going to be with Dr. Carolyn Rowley. She's going to share her story living with sickle cell and what she's up to today in the community. So be right back. This is the second verse, Young Ice.
So tell me what's the count? Had Jerry run a route and Montana throw it out. Atwater make him sober when the back try to bounce. So I'm flipping through the channels as the bulls where I'm out. Joined over 40 enemies, closed mouth. So I'm ESPN, they bury like a mouse. Scatting through the rivals, playoff idol. He'll make all enemies suicidal. Similar to Marshall Falk, a quick bouncer. Scatting on the fast, all you hear is the announcer. Then competition, so the crowd scream louder. Then he realized Roger Craig is his founder. So he sits on the defender around. As Kareem, my dude, your ball hooks a mountain. Magic with a pass, so the Lakers straight clowning. All I wanna know is homeboy, what's the count?
And also we're gonna have Dr. Kiana Johnson, who just happened to be in town in Los Angeles today, and she's gonna share her story living with lupus and what she's up to in the community. So we'll be back with that. This is the third verse, one of my favorite verses. This is my man IG The Great for you boxing fans. Check it out.
Born in the ring, all my life I've been a fighter. Greatest upset in history, noted the sports writer. Put me in the Olympics and guaranteed I'm the torchlighter. Provider of all the lyrics that are blowing scorch fire. I'm in the locker room, getting my hands taped. Thinking speed of a cheetah and strength of a man eight. I'm feeling bad what I'm about to do to this man face. But he the opponent, so I'm on the loss I can't take. Hands like Mayweather, swag like Ali. You think you way better, homie, than I see. And then I think they call me Hitman, Tommy Hearn. And y'all be biting like Tyson, I learned. And I don't gotta be flashy in front of the camera. All I do is show my warrior heart like Evander. Never been knocked out, but I've been knocked down. Long as I make it to the next round, what's the count?
All right, so this show, WDC Radio, is created to support my sickle cell trait and sickle cell disease community. But what I realized is that when I walked out in the community, I want to be able to talk about what they care about. So the platform now is a show where I'm handing the microphone to our silent minority. Like, I'm giving our community a platform to share whatever they care about. If it's arthritis, if it's lupus, if it's bullying, mental health, whatever those issues are in the community, I want them to be able to come here and have a place and have a voice. So here today, I'm just going to get started. Dr. Carolyn Rowley, I want to thank you for coming here and sharing your story living with sickle cell and just who you are in the community. Can you introduce yourself, please?
Sure. Thank you. Thank you for having me on the show. And it's an honor to be able to spread the word about sickle cell disease and sickle cell disease awareness. Um, as you know, sickle cell disease is a hereditary disease, so you're
Yes.
born with it.
Right.
You cannot catch it. It doesn't just come about.
Right.
You are born with it. And so, in terms of my story, my parents found out when I was 2, and I was unable to. I had asked my mom if I can go to the bathroom, and my mom responded, "Oh, you know how to go," but I was in pain.
Right.
And so, at that time, there wasn't much known about sickle cell disease, so it took them. My dad took me to the hospital. They didn't know right away. After running tests, they didn't find out until several months later that it was sickle cell disease.
Now, before you go, did your parents know that they had the sickle cell, the traits?
No,
No, they didn't. No idea.
they had no idea until that moment.
Wow.
And so I think from that point on, um, my story has been one of service. And so about the age of 5, I dedicated my life to God, and that's all I wanted to do was to be in service.
At 5,
At 5.
just Jody, what do you want to say about that as a young child?
Yeah, my mom started at 12, and I was raised in the church, but I didn't turn my life around until '94.
Okay.
That's a blessing. And that's why
Okay.
we still here. We both are. All three of us. All of us.
Exactly. So what was life in elementary school living with sickle cell? What was that like for you?
You know, unfortunately, I I don't recall other than that I was in and out of the hospital.
Yeah.
And it wasn't until high school that, again, that was another defining moment because, like I mentioned, at age 5, I dedicated my life. And then in high school was another pivotal moment for me
Hmm.
because of going in and out and dealing with the pain. There was a period of time in high school where I just basically said, um, I didn't want to be here. So Lord, if you wake me up to continue to live with this disease,
Yeah.
then you're going to give me the strength and the wherewithal to deal with it without complaint, without being depressed, basically to move forward
Okay.
and to continue to do service. So the fact that obviously I woke up and
That was it, right?
that was it.
So let's kind of get this in
looking back.
stages. I want to capture this your story in stages. So during the elementary stage, the school time frame, you were more in and out of the hospital.
I was
what
in and out of
that?
the hospital quite a few times. I remember having pneumonia pretty much every time that I went in.
Yeah.
But again, I don't. The only thing I recall is being in and out of the hospital a lot.
Yeah.
The good thing is I didn't have to repeat school. Um, I don't recall ever having to repeat school,
Okay.
but I do recall being in and out frequently.
How about your interactions with the kids during elementary school time frame? Were you able to talk to your friends about that? Do you remember any?
No, it's funny. What I do remember is that, and I still have them. I think the teacher must have had the kids write cards for me.
Oh wow.
So I have like an envelope full of all these different get well cards.
Oh wow.
I don't think that the children understood what it was that I had, and I do
Yeah.
recall um, at one point somebody thought it was contagious.
Right.
But again, being a child, I wasn't as familiar with my disease, and I don't think the children were.
Right.
They just know that I was always, ill.
Kind of ill. Now, how about your junior high school days? How did that develop?
Given that I had a Catholic school upbringing, it went from first through eighth and then ninth through 12th.
Okay.
So for me, it went from elementary to high school.
Okay. Okay.
And high school, I don't recall being in as much, but like I mentioned, it was a pivotal moment for me with respect to how I was going to live out my life. And because I had that talk with God, for me it was if I'm going to live, then I need to live with purpose and not with being depressed, not with saying why me, but knowing that there was a purpose. And so that actually was a pivotal moment, and I have lived my life
So
like that
so
so
the
far.
day before that pivotal moment, like how was it like mentally? Were you depressed during this? You're living with sickle cell at such a young age. Like, what was your life experience?
um,
I mean,
I, I wasn't a depressed person.
yeah,
But when I was ill, um, I was depressed. So only during those periods
right,
did I feel bad. I didn't understand, and the pain was too great.
right,
And that was one of the reasons why I had said, okay, you can take me, God, I'm ready.
yeah,
But if you don't, then you're going to give me the strength to be able to move forward with my life.
yeah,
And so that's what I recall happening. So I think to get to that point,
yeah,
there must have been there must have been great angst within my life to get to that point where it was either or. Either I'm going to live with purpose, or I'm
yeah.
going to continue to moan and groan and be sad and be stuck.
Can you share with us? You have sickle cell SS or SC? Can you share with us?
I have SS.
SS.
Hmm.
Okay. The question I want to ask you was before. No, I got it. Did you have any major surgeries during this time? During your
No.
no major surgeries?
So elementary and high school, no major surgeries.
Okay.
Mm-mm. And then I went on to college, and I went to Loyola Marymount University. And then I went on to graduate school to Southern Illinois University at Carbondale.
Okay.
And that was quite an experience.
So let's go to the first college.
Okay.
Um,
That was fine. I was in California. We're very cosmopolitan here. So it was.
Stress? Any stress during that time frame that triggered any crisis during your college?
I had, yeah, I was still going in and out of the hospital, unfortunately, through college, but I had mentioned to my professors, they worked with me. It was actually I was okay.
Yeah.
It wasn't until I went to graduate school that that was another pivotal moment.
Okay.
And that was the first time that I had ever experienced institutional racism with the hospital. And I had been abused by nurses. It actually was pretty awful.
Yeah.
And I had made such an investment in my education. So, my mom wanted me to come back home, but the stakes were too great. I
Yeah.
wanted to complete my doctorate.
Yeah.
And so,
Can you
it
share
was-
with some of that experience where you say that?
Well, because where I went to school was very small,
Yeah.
population 26,000. Again, I come in being very knowledgeable and informed.
Yes.
What I found out later is that the few persons with sickle cell disease that lived in Carbondale were not. So I was tagged as someone who was drug seeking because I knew exactly what worked for me, so I can get back on my feet and
Right.
continue to, I'm in graduate school now, so you need to keep going.
Right.
And moving forward. And so it's a small town, and the doctors talked to each other, and they were trying to ban me from going to the hospital.
Wow.
And then the other nearest hospital after that was in St. Louis, 2 hours away.
Wow.
There was no way I was going to drive myself 2 hours to get to the hospital. So if it wasn't for my advisor, who made it a way for me to actually get to the hospital and to be treated with respect, I'm not sure if I would have actually survived there.
Wow.
Or finish my studies there. So the academic institution was fine. It was the hospital that literally was very backwards.
Yeah.
Um,
That should be a good thing to know how much medication you need and what works for you.
well, it should be a good thing, but however, it was used against me.
Of course.
And so if it wasn't for Dr. Mitchell, my advisor, he literally turned things around because he
Wow.
had a lot of respect for me. And so my stay at that point in time became bearable
Wow.
in order for me to, be able to finish and move on. So that was crazy because
Yeah.
I had not experienced anything like that prior to.
Right. Growing up, did you interact with other children? with sickle cell in your community?
No, I didn't know anybody
So this whole time frame growing
that
up.
whole time frame. But my mom, single parent, she was not involved in the community,
Yeah.
and so therefore I wasn't. And she and my dad just kind of treated me quote normal.
Yeah.
So when I had a pain episode, it was dealt with, and then we continued on. It wasn't until I did my master thesis on sickle cell disease in children that I actually became um, familiar with more people who had sickle cell
Wow.
disease. So I did my thesis with the Children's Hospital in St. Louis,
Wow.
and then worked with people at Washington University. I was familiar with the foundation, and so when I got back home, from graduate school, I became more involved and started the support group, sickle cell
Wow.
support group for adults.
Which I attend one of your sickle cell support groups in Loma Linda, so thank you for doing that out there in the Inland Empire. That's huge. What are some of the things that trigger your crisis?
Well, now that I'm an adult and a parent, things are a little bit different. So I have to say, when I actually got married and had my daughter, it changed.
Yeah.
So I was no longer single and trying to do everything. I'm now married and trying to do everything. But I'm cognizant of having my daughter.
Yes.
So when I had her, my pain episodes actually decreased
Wow.
because I became a lot more conscious.
Okay.
I've always been vegan, so my diet, which I believe is a good part in terms of how people take care of themselves.
Of course. Of
My
course.
diet has been vegan and raw.
Wow.
So that part's under control. The thing about it was I wasn't eating. So once I had her, I realized I needed to actually eat
Yeah.
and just, I wouldn't say slow down, but just become more conscious. So I did, and my pain episodes, which I still have, but infrequently now.
Right. And I think that's what diet can provide,
Mhm.
eating the right foods.
Well, again, I was eating the right food. I just wasn't eating enough.
Yeah.
That was my issue.
Right.
But what triggers it? Like anyone else, it can be weather,
Yeah.
altitude, stress. I think for me, it tends to be dehydration, unfortunately, mainly because I'm very busy. I travel a lot.
Yeah.
And I'm very, very active, not only with sickle cell as my platform, but I also have an orphanage in Kenya. So between that and my practice and running my husband's company,
Right.
and then I have a daughter who's 14 now, I need to be a lot more conscious of drinking.
Yes.
And I think oftentimes that's what triggers it
Right.
for the most part for me.
Okay.
Um,
What when you decided or made that choice to have your child, I know some people in the sickle cell community, even the doctors say that's a risk. For you, what was?
and for me, it was a high risk.
Yeah.
High risk pregnancies, you have to see a perinatologist, a specialist. And what's funny is I had one of the best perinatologists, Dr. Samuel Bruce. And what's funny is that he was always laughing. So I would come in and he was always joking and, oh, everything's good. Then one day he wasn't laughing and joking.
Wow.
And one of the complications that can occur is that the placenta calcifies. Now you need your placenta because that's like the main thoroughway between the mom and the baby.
Right.
And if it calcify means hardening.
Right.
That's the concern, and that's where the problems tend to occur.
Wow.
So one day he just wasn't joking and smiling, and I'm like, oh, okay. So he said, I see some calcification. We're going to take a look at it.
Wow.
I was able to go full term, but I had to wind up having a C-section.
Wow. Do you encourage that in our community for those mothers who want to have children? What's your point of view on that?
Very interesting. So, if for me, I know that my husband does not have the trait
Right.
or the disease, and I know that my child was going to have the trait.
Right. At least. Yes.
And so I felt comfortable, bringing a child. And we're also going to, be adopting as
Right.
well. So if that is the condition, that the child is not going to have sickle cell disease, and that's what they want to do,
Right.
that's fine. But my only thing is, you have to take care of yourself. If you're not taking care, if you're sick, if you tend to become ill and have lots of pain episodes prior
Yeah.
to having a child,
Right.
my only concern is what's going to happen once you are pregnant and
Right.
have that child.
Right.
Because you want to be around for the child, and I want to be around for my
Of
daughter.
course.
And it's not up to me. Obviously, it's up to the Lord.
Right.
However, I believe that I'm doing my part
Exactly.
to the degree that I can
Being responsible.
to be here for my daughter.
Of course.
And so that's my only thing is, if you have a tendency of being ill and it's not under control, get it under control first.
Yeah.
With whatever you need to do, whether it's on getting the right medication, diet, decreasing stress, whatever that takes,
Right.
get that under control before, looking into that matter.
Now, I took on in this advocacy world as a prevention advocate, and that's the kind of conversations that I like to have with people because, there are adoptions, there are things that other ways to be parents instead of, having the child, especially knowing if making sure that you're both parents with a sickle cell trait, or if your husband has thalassemia trait or hemoglobin C or D, like those, that's important to know what's in your genes. For you, what do you think? What do you want the world to know about sickle cell?
That it exists
Yeah.
and that it's a global disease and it affects hundreds of thousands of people worldwide.
Yeah.
And it's not just an African American disease, it's in every culture. In the United States, it's primarily African American and Hispanic,
Right.
but worldwide, it's everywhere.
Everywhere.
And so it's it's in Asia, it's in Arab countries, India, Africa, both the western part as well as Eastern Africa. So that it still exists. Funding is most needed,
Yes.
and there are presently no federal dollars that they're spending on sickle cell disease for us to continue our work.
Right.
And so many of the organizations, whether they're grassroots or not, we're all struggling because there are no dollars spent for us to be able to take care of persons with sickle cell disease.
What's your point of view? I have the trait. So what's your point of view? And your daughter has a trait. With the trait community being aware of the gene and being aware of pain, we have crisis. Some of us realize that we do have crisis or issues with sickle cell trait. What's your point of view as a doctor and having a daughter with sickle cell trait? What's your point of view on that?
I know that with respect to my daughter, she's well aware. I mean, given her mom and what I do in
Right.
the community, and that she's been dragged to different events, she's well aware of sickle cell disease. She's well aware of just genetically how that's passed on.
Right.
She knows that she also needs to be aware of and ask questions regarding whatever mate she chooses.
Right.
So my only thought is, whether you have the trait or the disease, for me, health is always important. Nutrition, vitally important. So it doesn't matter to me which side of the spectrum that you're on.
Right.
You need to take care of yourself, slow down, become more conscious, not just live without consciousness,
Right.
but literally slow down and
I mean, because
and
the
engage.
NCAA is now, they're doing mandatory screening now with sickle cell trait. So obviously they're noticing that the trait can trigger complications, sudden death. I experienced the trait exertion. I found that soldiers in the military had been having those complications. Ryan Clark, as a professional NFL football player, lost his spleen and gallbladder. I mean,
Well, and
that's
for my daughter, when she's engaged in sports, and so she knows to always stay hydrated,
yeah,
and so we talk about that.
yeah. Okay. And you got any questions, Doctor?
No.
I know you care about sickle cell too, in your work. You have
Yes, it's just
anything you want to
nice
ask?
hearing just your process. But I don't have any
No
questions.
questions, Jody?
How often did you have any blood transfusions?
I've never had a blood transfusion.
Wow. That's,
I've always refused. I'm one of those informed, non-compliant people.
I don't blame you.
I use wisdom. I call
Yeah.
on wisdom. I am non-compliant, but I'm also informed. And so
Yeah.
I have to say, through all this time of having various doctors, I finally have a physician who respects me. Um, she wants to wring my neck at times, but she works with me and she honors exactly what I would like and what I need. And so to me, that's the best thing.
Yeah.
And I'm finally at that place where I have the absolute best doctor who cares about me. I can never say that until now.
She's out here.
She's out here, and I'm not going to say her name.
I know it's not
until
Dr. Patricia.
No,
I'm just making sure.
but I
That's one of my doctors.
but I only reason why I don't want to say her name is because I need
I
to find out
understand.
if she has any openings and all
Yeah.
that.
That's fine. That's
I
fine.
understand.
But
I
she is at the absolute best, trained well, and I could tell that she cares about me and
Right.
respects me. And as far as I'm concerned, that's what I need is someone who can work with me.
Yeah.
Dr. Johnson has a question. Speaking in the mic too.
Okay, I'd like to know about your transition from pediatric to adult healthcare. How did you find that process, and at what age did you transfer to adult healthcare?
So because I was never part of, unlike now where many children are part of a pediatric program, I never was.
Okay.
Wow.
So my transition was pretty much always individualized. I was always on my own. So that's what I recall is that I was always on my own. At the same time, it was hard because I would still have to go to the hospital by myself, try to manage and let people know what I want. It's been trying. I don't like being looked upon as being a drug addict when if they truly knew who I was, that would just be an abomination.
Right.
Because I never smoked, never drank. So to be looked upon as that,
It's offensive.
It's
it's
definitely
very-
a
it's
stigma
very,
we
very
need
hard.
to
Yeah.
a stigma
It's
we
very
need to attack.
challenging.
Yeah.
Definitely a stigma.
and that took place whether I was transitioning or actually recently before I actually transitioned to my new doctor now for the last year or two. Just recently, I've had challenges going into the hospital, but I'm happy. Again, I don't focus on the past because going back to the past is a cliff. It doesn't
is.
exist.
Right.
All you're going to do is just fall down into darkness.
Yeah.
I always move forward, and I'm happy where I'm at right now.
We got a caller before we're gonna take a break, but we got a caller right quick. Let's see who this is. You're live at What's the Count?
What's happening?
What's up?
What's up?
What's up? What's up with you?
WDC, baby, what's the catch?
Hey, you have any questions for the doctor here?
No, I was just listening to, how she say, it's hard to deal with certain issues, especially when you think you're by yourself. So
Definitely.
I was just calling in, I like to call in and check in when I get the time,
Man, thank you, man. Thank you. Hey, thanks for.
I do have a few questions.
Go ahead.
Like, I like in Charlotte, North Carolina, we deal with the issues right now. I'm having bad chest pain, and I'm hurting real bad.
Okay.
But when I go to the hospital, man, it's like these doctors don't understand that sometimes, like, just because they do my blood work and my blood work say my hemoglobin not low, they think I'm not hurting. How could you deal with that situation?
That's a good question because, and it's unfortunate that people are looking at quote your vitals, or you can't look at that to determine whether the severity of one's pain, because there could be other things taking place. So the only thing I can suggest is that where you go, you try to always kind of keep them informed. I know it's difficult because you're trying to advocate for yourself, but many things can be taking place. I mean, you could be having acute chest syndrome, um, or an infection. Other things can be taking place, and they can't just look at your blood count to decide the severity of your pain.
Right.
And so all I can do is say that you have to continue to advocate for yourself, keep yourself informed in terms of going to whatever seminars that we put on, but also to attempt to communicate with your doctors about having them look at not just your blood count, but other things that could be taking place. Because you might be having, like I said, an infection,
Right.
acute chest syndrome, or other a host of other complications that they need to look at.
Right.
So that's all I can actually say.
All right. Hey, Tone Capone, man, thank you for calling in, man. I appreciate you.
Man, you know, I always try to check up on you, baby.
All right.
You're doing a wonderful job spreading word, man. And once again, I'd like to thank you for all your hard work, man.
Man, thank you. All right. I appreciate you. All right, we're going to take a quick break. This is WDC Radio. I'm your host. I'm WDC. Dr. Karen Rowley, thank you for being here. We're going to come back to you. Got Dr. Johnson coming up next. We're going to take a quick break. WDC Radio. We'll be right back.
That we've been struggling for such a long time, working here and there just to get by. It's finally time for me to get mine. No more robbing peers so we get paid for, or calling to mama's house to make a phone call. But no, we don't have to struggle at all. 'Cause now every day is feeling like Friday. I'm getting paid and doing it my way. We're finally on our way. Baby, now it's time to celebrate. Oh, live it up. We can go crazy. Live it up, you and me, baby. Live it up, live it up, live it up. We're flying high. Don't wanna come down. Let them know. All over town. Live it up, live it up, live it up. Put it in the layaway. 'Cause boo, I got the money today.
Hi, this is Susan Levin, owner and founder of Speaker Services, inviting you to join me and co-host Jean Noel Bassiar on Monday evenings, 5 p.m. Pacific, for our new show, Talk Up Your Business, Speak Your Way to More Profits. We'll be talking to you about how to use your expertise to grow your business or service through speaking. Our expert speakers and author guests will share their stories and success secrets with you. Don't forget to tune in to Talk Up Your Business Mondays at 5 p.m. Pacific, exclusively on latalklive.com. You can also catch us on iTunes Radio R&B or watch us on Ustream.tv. Reality radio, handcrafted for your listening pleasure. This is LA Talk Live, and we are more than just talk.
Hi, this is Dr. Levi, your fitness doctor, making a personal house call, inviting you to join me Wednesday at 10 a.m. Pacific for my all-new show, The Dr. Levi Show. Join us as we discuss fitness, health, and well-being, including emotional and spiritual health. So don't forget to tune in to The Dr. Levi Show every Wednesday at 10 a.m. Pacific, exclusively on latalklive.com and the Talk Live Broadcast Network. You can also catch us on iTunes, Radio R&B, or watch us on Ustream.tv, or catch us on the Live 365 network, and now on Radio Flag and Stitcher Radio. Reality radio handcrafted for your listening pleasure. This is LA Talk Live, and we are more than just talk.
All right, welcome back. This is WDC Radio. I'm your host. I am WDC. All right, we're going to get the second half of the show started. Dr. Kiana Johnson, you're truly a blessing. I want to thank you for coming on the show today. Thank you.
Thank you very much for having me.
Please introduce yourself to the listeners.
My name is Kiana Johnson, and I have systemic lupus. I have had it since 1996, so that's about 19 years.
Wow.
And I am here visiting LA. I'm very just honored to be able to be here on the radio show today.
Great to finally meet you in person.
Yes, thank you.
Dr. Lakia Bailey introduced us. You met her at a conference.
Yes.
And because I had been doing work with the lupus community, she put us in contact. And you care about sickle cell too, so there's some things that we're going to share what you're up to. When did you first find out, you said 19 years ago, about your lupus? What was that?
I was in 8th grade, and I was sick for about a year and a half. During the 8th grade year, I had a social studies teacher who noticed that I had all these different bruises all over.
Mm-hmm.
He approached me after a class, and I remember it like it was yesterday.
Wow.
But he approached me and he asked, Kiana, is there anything going on at home? Are you all right? And I kind of looked at him like, what kind of question is that? I mean, I'm an 8th grader.
Right.
So I asked him, and he goes, oh, well, you have these bruises all over. And I looked, and I had never noticed them, but they were on my neck, on my torso, all over my legs and arms. And they were pretty big bruises.
Yeah.
And so I went home and I showed my mom, and she was just like, oh no, we got to go to the hospital.
Right.
And so it actually, he started what would have been an open CPS case, just out of concern.
Wow.
And so we went to the hospital, and I was there for about 2 weeks, and I was diagnosed with lupus, and I had 11 of the 13 criteria.
Wow.
And so the bruises were from idiopathic thrombocytopenia.
Wow.
And then I had kidney involvement as well, and I had lost a lot of weight, but I had seen doctors previous to that.
Yeah.
But no one had diagnosed me with lupus.
So a lot of time when I interview people living with lupus, they kind of can remember something either in the environment or stress. Was there something in your 8th grade childhood that kind of triggered that you can remember that maybe triggered?
No.
Nothing?
I was very healthy until then.
Yeah.
For that year that I was sick, nobody could figure out what was going on. I was running a fever just about every single day.
Yeah.
And we would go to the hospital. They'd do a spinal tap and couldn't find anything. And I went to 2 different specialty children's hospitals.
Yeah.
And they found nothing. But when I was back in Indianapolis, I was diagnosed. They did a bone marrow biopsy as well as a kidney biopsy.
Yeah.
And granted, that was a year after going back and forth to doctors. But I cannot recall anything
nothing leading
that
up to that
led up to that event.
Wow.
But I was never sick as a child. I was the one that I was the healthy one of all my friends.
Wow. Wow. So what was that experience like, finding out that you're being diagnosed with lupus at such a young age?
At the moment, it didn't really. It was like, oh, okay, well, I have lupus, and I was in the hospital for a while. But then after I was released from the hospital, I was going to school part-time in 8th grade, so I would go for half days because I was getting Solumedrol IV steroid treatment.
Okay.
During the first month or so.
Yeah.
And then it seemed like everything changed. I went from being 82 pounds to like 120 pounds.
Wow.
And it was very drastic weight, and I'm very petite, so it's very noticeable.
Yeah.
I remember one of the first things I remember in going back to school full time in 8th grade was my English teacher said in front of everybody in the class, Kiana, have you seen a dentist? And I said, no, I didn't see a dentist, and my face was very round. And she said, oh, well, you look like a chipmunk.
Oh,
and that
wow.
name stuck from
No way.
middle school to high school.
So those are those kind of conversations, man, that really, we don't realize that we do that to people. How did that impact you mentally at that point? Like,
oh, to hit her.
I was a bit embarrassed.
Yeah.
But, it's kind of shameful, having this person of authority saying something like that. But,
exactly.
And I know she meant no harm in doing so, but being an adolescent girl kind of works with your self-esteem.
Yeah. Of course.
And I battled back and forth being on prednisone. I've never been off prednisone during the whole course that I've had lupus. So whenever I get sick, I'd be on high-dose steroids, and I'd gain weight I just gained weight very quickly.
Right.
But in high school and in middle school, I would do a lot of maladaptive behaviors to get rid of the weight.
Yeah.
And if it meant, stopping the prednisone and ending up in the hospital, that's what it meant.
That's what it took.
And it took me a while to learn. Finally, maybe my junior year in high school or senior year in high school, maybe first year in college, when I really just said, you know what, if I'm going to take the prednisone, I'm just going to gain weight. That's just something I'm going to have to deal with, and that's something I'm going to have to get over, and that's just what it is. As opposed to, stopping the prednisone and just doing crazy things.
Is there a decision that you made when you heard that teacher say that kind of shifted as like now I got to do this, or now I got to be this person? I mean, because I know that was hurtful.
It was very hurtful, and it started, I think more of I needed to think of how I could ignore or just not think about it. So I was more avoidant, and I didn't talk about having lupus. I didn't. Most people didn't know anything about it. Matter of fact, I would avoid it at all costs. So I would do things that most people shouldn't do just because it was proving that I could be like everybody else.
Right.
And I also couldn't. The other thing that I added on to that was that I couldn't do gym in 8th grade. And so our 8th grade gym teacher made sure that everybody knew the reason we couldn't go outside was because Kiana couldn't go outside.
Wow.
So it was these kinds of things that added on and
of course
made it easier to want to avoid the facts.
Did you have any what was your mental release from that?
Well, I played the flute.
Okay.
In middle school and high school, and I played a lot when I was sick because that was one of the few things that I could do.
Right.
And I had a few really great friends who were there thick and thin, that it didn't really matter what was going on, and they just kind of provided that support that I needed.
Definitely. I think we have a caller. Let's see who this is. Might be Dr. Bailey. You're live at count. You're live at what's the count? Don't be shy. Hello?
Hello?
Yes?
What's the count?
Hey, what's going on?
Hey.
That's Krishan.
That's
How
Krishan.
you guys doing today?
Huh?
Listen, how you guys doing today?
We doing good. How are you?
It could be better.
Yeah? This is Krishan, my teammate in Las Vegas. She's in the hospital in a crisis.
Oh, hey. I know Krishan.
Yeah.
Hey, how are you, dear? This is Dr. Carolyn Rowley.
Hi, Dr. John. Oh my goodness.
It's good to...
I haven't seen this Capitol Hill. I didn't even get to say bye to everyone because I almost missed my plane.
Well, Capitol Hill, she said she didn't get a chance to say bye to you.
Yeah, no problem, hon. So I'm sorry to hear that you're in the hospital right now.
It's okay. As if these doctors are giving me such the runaround, like I really had to be that patient advocate for myself. And the other patients who are in here, they discriminate. They keep stereotyping. Oh, she just wants her drugs. We're not going to give her Benadryl because she just wants to be sedated. Like all kind of stuff. I've spoken with the case manager, the medical director of the hospital, the house of supervisors, charge nurses, and the one doctor I filed a complaint earlier this year. And his retaliation back to me was he decreased all my medications. He went from 2 milligrams of Dilaudid to 0.5, and then out of 50 milligrams of Benadryl. So that was the ultimate disrespect and a slap in my face. Like, are you kidding me? And so, like, I when he came in, I told the nurses I don't want him to be my doctor. I don't want to have nothing to do with him, And when I said no, I just told him to discharge me, and I left and have come in. I stayed at home almost the whole day, but I was still in a lot of pain, and I knew my blood platelets were low, and also my hemoglobin. And I was just like, okay, let me just try to go back. So I went to this hospital, Desert Springs, and I've never been here before, but I was like, I thought I would have been able to have my pain under, control by now, but they went such like long periods of time without checking on me, making sure I had my medication and stuff that it's just ridiculous in here.
And you're at Mountain View right now, right?
No, I left there.
You left there? Where you at right now?
At Desert Springs Hospital.
Desert Springs, okay.
You know what?
Yeah, and then the doctor that I had, I didn't even know her. She became assigned to me once they told me I was being admitted, and they moved me to the other side of the emergency room. She did the same thing the other doctor did earlier this year, except when she completely discontinued the Benadryl and gave me .5 of blood. And I'm like, what is wrong with these people?
Hey, Krishan.
They don't understand.
Krishan, Dr. Rowley wants to say something to you. Hold on.
Hi, dear. So I totally understand. I was just mentioning that earlier. So one of the things that I want the audience to know about what it is that we want, I think we just want to be believed when we go into the hospital that we're in the amount of pain that we say that we're in, that we know how much medication that we need in order to actually address the pain. We need both the nurses and the physicians to believe us. We need for them to medicate us properly. We need for them to titrate us so that they don't just take us off right away or not give us enough, because when they don't give us enough, what happens is we wind up coming back in sooner than what we need to because the pain was never addressed. So what you're talking about right now, I'm so glad that you called, is because everyone can actually hear a person who's going through the storm right now. This is exactly what happens, and not just to you, but to nearly every single person who goes into the hospital who has to beg to be treated with respect and with as a human being and to be heard.
Exactly.
So for me, what is it that we want people to know? Please just believe us. And if you think that we actually have a problem, then call the social worker later, after our pain is addressed,
right?
and have the person come in to address whatever those other concerns, emotional concerns or social concerns that you think might be going on. But right now, we have to demand to be treated with respect and have our pain dealt with, because other illnesses, their pain is dealt with without any problem.
Yeah.
And so, but for us, it isn't. And so I'm so sorry, hon, that you're going through the storm right now by yourself and that they aren't believing you and you're suffering. And so this is, again, that's an abomination. I totally understand where you're at, and obviously you're not alone.
Yeah.
But I'm glad that you called so that the audience can actually hear this is what we go through.
Exactly.
Exactly.
On a daily, every day. And then they didn't even hook me up to any fluids for about 8 hours with no oxygen.
Wow.
I said, who does that? Where do they do that at? I said, I have sickle cell, but you need oxygen for your oxygen is fine. Because my blood isn't getting enough oxygen. That's why my
she has SC too, so it doesn't show up in her blood work that she's having it should be having a crisis. So hey, Krishan, I have Dr. Kiana Johnson with us too. We're talking about lupus, so so she's here too with us, so she knows who you are too.
Hello, Miss Kiana. How are you?
I'm well. I'm sorry to hear that you're not doing well.
It's okay. Just keep me in prayer, and I'm out of here by tomorrow because I have to be at a town hall meeting with Congresswoman Maxine Waters and Congressman of Nevada, Stephen Waters.
That's right. That's my teammate out there getting it in, even in the hospital. Hey, thank you for calling in.
I'm going to need you guys' support September 14th.
We got
I'll
you.
be speaking on a panel about the Affordable Health Care Act with the Congressional Black Caucus this year, and I guess from now on, working hands-on with them pertaining to sickle cell because nobody else stepped up to represent the state of Nevada. Miss Carolyn knows, what was going on because I was with you the whole time, and they mixed up my appointments, everything. So I had to go do everything myself once I got to the Capitol, find his office, and he wasn't there, but I left my information, and they made my appointment last Monday, the Monday before, and everything's in motion, ready to roll. And like I told Congressman, the only thing holding up our funding to get a clinic started here for the adults, because we have a pediatric one here in Nevada, is I told him it was a congressional and a legislative issue, and he's, the one who has to sign off on it.
Yeah.
And so I was like pretty much almost done with my 501c. I did the application and the provisions and the development and the budget and everything.
Okay.
But I had it filed because I was getting sick, so I handed it to the congressman, and he made one phone call to the senator's wife over the state of Nevada, and she's also an attorney. And he asked her if she would finish up the rest of my paperwork pro bono ASAP because we need it by September.
Okay. Hey, Krishan, I'm gonna finish the interview with Dr. Kiana Johnson, and me and Jody will give you a call after the show.
I'm listening.
Okay, listen in. All right. Thank
Okay.
you.
Bye-bye, dear.
I'm T-Boss. Call me.
This is guy over here. Dr. Johnson, going through your schooling, like how did you manage your lupus in college?
Oh, wow. By God's grace.
Yeah.
I think so. I had more active disease in my teen years as well as maybe my first couple years of undergrad.
Yeah.
I had a really hard time with managing my health and managing school at the same time. I
Yeah.
mean, there was one point where I was actually dropped from the university, where I couldn't do it. I couldn't do it all. And so I was on Medicaid as well. During the time that I had Medicaid, sometimes my Medicaid would fail, and so I needed to get a job because I needed my medicines.
Wow.
There are certain drugs that you cannot stop, and so I do that back and forth, and at one point it just became way too much, and I did not heed others' instructions in terms of registering with adaptive programs until after being dropped. I was very prideful in that, I didn't want anybody to know what was going on. I didn't need any help,
Right.
Anything of that nature, but after that happened, I had to reconsider lots of different things and reevaluate just what it is that I want to do
Yeah.
and how I want to go about doing it.
Right.
And I got a lot of advice, and my pediatric rheumatologist, she was probably my best advocate in terms of just encouraging me to make sure that I do the necessary steps to get back in school and to get things done.
Yeah.
And the first thing she said, I just need to get over this whole pride thing. And
Pride can stop.
It can.
That's like a wall.
Yes, it was my wall. And so when I was readmitted back into Purdue University, and I registered with adaptive programs, and it was helpful in that I missed a lot of course time, as well as sometimes I would need an extension because I was receiving a drug called Cytoxin.
Yeah.
And so I would need to go to Indianapolis, which is an hour and 20 minutes away, to get a chemotherapy treatment.
Wow.
And so sometimes I need to be away from West Lafayette, which is where my school was.
Right.
So during this time, it made it easier to be able to turn in work, and also if I wasn't feeling well, professors, they understood, or they were expected just by the rules that govern the adaptive programs offices,
Right.
that either they had to let me make up assignments when I was gone to medical appointments, or that I got an extension on doing different assignments. And that was, it was a learning experience,
Yeah.
and just disclosing my health information. But I kind of saw it as like a crutch initially, but it wasn't that at all. It actually helped me to do my best,
Right.
which is, it was a learning experience. It took me hitting that wall to actually figure that out.
And you have oxygen that you carry, so
Yes.
share with that.
Okay. Well, I recently moved from Indiana to Minnesota because I graduated in May of 2012 with my PhD.
Yeah.
And I got a position. Thank you. I got a position as a postdoc fellow, and I'm doing research focusing on the transition from pediatric to adult healthcare and
Yes.
adulthood among youth with chronic conditions. And so my focus is on transition, and I'm making this transition myself. I am also transitioning at the same time to adult providers, and I thought everything was doing very well all last fall, and I thought I had a cold, and so I work with a lot of other physicians, and one of my friends who's also a physician was like, you should see a doctor about that cough, and I thought, I'm all right. It's just a cough. It's just a cold. And I do know that pneumonia is one of those things that I don't want or need.
Right.
It's a very serious issue in lupus patients. And so I thought, okay, well, you're a doctor. Can you just listen to me breathe? And
Right.
she said, I'm your friend, and I think you should see a doctor.
Wow.
I'm like, well, you're my friend and a doctor. But then we went back and forth, and then I said, you know what? I'll see a doctor. And I went to the doctor thinking, nothing's going to happen. I'm going to go here, and they're going to be like, you're just fine and whatnot. So I went to the doctor. My pulse ox was at 74. And that my oxygen level was just really low. The oxygen levels in my blood was really low.
Right.
And I spent a week in the hospital with them trying to figure out what the issue was.
Right.
And I have a neuromuscular weakness of my diaphragm, so it's not working properly.
Wow.
To pull air in and out of my lungs.
Right.
So it's called shrinking lung syndrome. And from my own reading of the disorder, it's kind of like I don't really know what's going on with your lungs.
Right.
But there are very few cases in the world with it. And
Wow.
I think there are like 78 reported cases of shrinking lung syndrome. And I think it's getting better. For my own health, it's getting better. Before, I couldn't do much of anything without the oxygen. I'd have it on 24/7.
Wow.
And now, if I'm sitting down and not doing anything that requires a lot of exertion,
Yes.
I don't put it on, and I don't really need it. But if I'm up, maybe doing 3 flights of stairs, that's a different story. Yes, and so I've been doing that, and it's brought up a lot of different issues in terms of just healthcare and medical coordination and just things that I thought I was pretty much an expert in.
Yeah.
But being in the adult healthcare system, I realized it's a completely different ballpark.
Exactly.
Yes.
And I want to thank you because when I met you and Dr. Beta was like, hey, she wants to do this, transitioning for lupus adult. I'm like, oh yeah, like you, because that's my conversations, my main 2 conversations. So it's truly a blessing to have you actually come here live and sit with me and share. What do you want the world to know about lupus, really?
Well, I'm an advocate for lupus, but specifically, I really do try to advocate for childhood lupus.
Yeah.
Because a lot of people don't know the prevalence of lupus in children, but then also just the lack of research that's going on with those children who are now living into adulthood.
Right.
And the outcomes are pretty poor. I mean, there's a lot of progress, but I don't think the progress is acceptable, and I don't think it's enough.
Exactly.
But that, children do get lupus, and you get a lot of disease progression as well as damage in the early years.
Secondary
Yes.
complications is
And
what I've discovered.
Yes, a lot that
of
result
secondary.
from having the disease for so long.
Right.
Yeah, basically that children do get lupus, and
Yeah.
that it's something that needs to be addressed. And I think if you address it at the younger ages, that within this group of children, then you get fewer and less complications in adulthood.
And just share with the people listening, in case they don't know what lupus is, what it's an
Lupus
autoimmune.
is an autoimmune disorder. It's a multidisciplinary, multi-system or multi-organ disease, where basically your white blood cells over-reproduce and attack your body. That's my most basic example of it.
Just your immune system attacking itself.
Yes.
You can't differentiate from a virus or bacteria.
Yes.
So it attacks its own organs.
And it doesn't recognize.
That's amazing. And Joe, do you have any questions? Do you have a sister? Joey has some family members with lupus.
I have 2 sisters that has lupus. She was very, I think she was in her
Talking to the mic, Jody.
She was in her late 20s. She was playing basketball, very athletic, going all over the country. She tried out for WNBA. Then 10 years later, she started getting sick. And she recently just got out the hospital, and she's constantly losing weight. Nothing's working for her, and I'm trying to get her to call in.
Yeah,
because I'm trying to get more education on lupus myself. But hopefully we'll get her to call in, because I really want to help her.
Dr. Rowley, you have anything you want to share, Dr. Rowley?
I do. Sounds like besides that, the fact that we need more federal dollars for sickle cells, we also need more federal dollars for lupus as well.
Definitely.
That's what it sounds like.
Yeah.
And so I think on that note, with respect to federal dollars, the primary thing is that sickle cell disease exists, so we need to have some kind of awareness regarding sickle cell disease as well as lupus.
Exactly.
Once we have awareness, I think people can start talking to their congresspersons, assembly persons as well, because it's not going to happen just because we wish it.
Right.
It's going to have to happen, unfortunately, by people talking about it, and we
Right.
talk about it by making more people aware.
Ness, I got a few minutes. How much time I got?
Got about another 2-3 minutes.
2-3 minutes. Okay. I wanted to share. First, I want to thank you for coming.
Thank you.
And you was in town, and I want to thank you for coming and sharing your story.
She's a Johnson like me.
Do you between the two of you, do you think the relationship between sickle cell and lupus, like he's 11 brothers and sisters, he has sickle cell disease, 2 sisters with lupus. You think there's something going on in those? Are they
connection.
cousins? Are they something? Or just totally opposite? Just
it's actually opposite.
just
because
totally
we're
opposite,
talking
right?
about a red blood cell disease,
right, and a white blood cell,
and
exactly.
versus a white blood
Exactly.
cell disease. It's just the odds, and
Because I've by doing this, I've met people with sickle cell trait and lupus. Like Dominique Friend has sickle cell thalassemia and lupus, so it's just.
But I think maybe it depends upon, because we were talking before the show, the population of persons that it actually affects.
Right.
So that actually, I think, has more relevance than the fact whether or not they're cousins or not.
Yeah.
So the fact that for sickle cell disease, it's primarily a person of color disease around the world.
Right.
What's your research show with respect to lupus?
Lupus disproportionately affects ethnic minorities.
Yeah.
Exactly.
Exactly.
So I think in that respect we have some, relevance.
Exactly.
But there's no federal dollars, and people aren't spending the time or no money to research it further. In terms of programs and
Exactly.
helping persons who are adult living with the disease. That's what we need,
Exactly.
actually.
Although,
Go ahead.
on that note, I recently started a foundation. It's called the Childhood Onset Lupus Education and Research Foundation,
Yes.
and it is to provide support and advocacy for young people, children and young adults with childhood onset lupus, just as they transition to adult healthcare and adulthood.
Give them that website again so they can.
It's the Childhood Onset Lupus Education and Research Foundation, and you can look us up on Twitter as well as on Facebook. Yes.
Thank you, and please let the
I was gonna
community
say.
know. Yes.
And so with myself, I have the Cayenne Wellness Center and Children's Foundation. And so my platform with respect to sickle cell disease, we have various support groups: Los Angeles, Antelope Valley, Loma Linda. We've also put on annual seminars and educational seminars on sickle cell disease, inviting both the persons living with it, family members, and healthcare providers. We do canvassing. And what canvassing is that we actually go out to malls and we're passing out information about sickle cell disease, period, so that the people know that it still
Exactly.
exists. So that's what we do, Cayenne Wellness Center and Children's Foundation.
I appreciate it. Any emails you want to give out email address in case they want to email you? You can give it.
Sure. Info at CayenneWellness.org. Cayenne like the pepper, CayenneWellness.org.
And for the Clear Foundation, it is info at childhoodlupus.org.
Think you. And you can follow me I'm on Twitter at IamWDC. And if you want to send me any information, it's at WDCONSCD@gmail.com. That's my email address. I want to thank both of you. This is truly a blessing to have both of you here to share with our community
Thank you.
who you are and what you're up to and what you're battling and helping the community out with too. So thank you both.
Thanks.
Jody, 2 seconds.
At DBC Jody. You want to Twitter me.
All right.
Peace out.
This is WDC Radio. We'll be back next Monday, 11 a.m. Pacific Standard Time, 2 p.m. Eastern. You can catch me on Twitter. On Trench Talk. Saturdays here on LA Talk Live, 13:30, 1:30 for you civilians. Trench Talk on Saturdays. Thank you.
You know I like the way the dribble up and down the court, fast and slow. 25 years ago, the WDC, and it's me, your man Curtis Blow. From Dr. J to Michael Jordan to Kevin Durant, who leads the whole league in scoring. Dwayne Wade down in Miami, making a name. I love this game. To the NBA Hall of Fame, slam dunks, alley-oops, and the give and go. Vince Carter, Superman, and my man Carmelo and Rondo over in Boston with the big three, captivating audiences across the country and ruling the world like LeBron the King. I say, man. man. Kobe sure has a lot of rings. That's my thing, not for the bling. Bling in the amount. It's the NBA Finals, so what's the count?
Tell me what's the count? Had Jerry run a route and Montana throw it out. Atwater make him sober when the back try to bounce. So I'm flipping through the channels as the Bulls where I'm out. Joined over 40 enemies, closed mouth. So I'm ESPN and buried like a mouse. Scattered through the rivals, play off idle. He'll make all enemies suicidal. Similar to Marshall Falk, a quick bouncer. Scatting on the fast, all you hear is the announcer. Then competition, so the crowd scream louder. Then he realized Roger Craig is his founder. So he sits on the defender around her. As Kareem, my dude, jump all hooks a mountain. Magic with a pass, so the Lakers straight clowning. All I wanna know is, homeboy, what's the count? And
This is